Welcome. Today we're diving into a rare and complex condition, adenocarcinoma of the urethra. This video aims to provide a comprehensive overview, covering everything from its origins and development to diagnosis, treatment, and future research. While this information is for educational purposes, it's crucial to consult with healthcare professionals for personalized advice and treatment. The exact cause of urethral adenocarcinoma remains largely unknown, making it a challenging cancer to understand. However, several factors are believed to play a role. Chronic irritation or inflammation of the urethra, perhaps due to recurrent infections or long-term catheter use, is considered a potential contributor. Some research suggests a link to pre-existing urethral conditions like urethral diverticula. Additionally, certain risk factors, such as advanced age and possibly smoking, may increase the likelihood of developing this cancer. However, it's important to stress that many individuals with these risk factors will never develop urethral adenocarcinoma. Adenocarcinoma of the urethra develops when healthy cells lining the urethra undergo abnormal changes, leading to uncontrolled growth and tumor formation. These tumors originate from glandular cells within the urethral lining. The process begins with cellular mutations, causing these cells to proliferate rapidly and abnormally. As the tumor grows, it can invade surrounding tissues, including the bladder, prostate in men, or vaginal wall in women. In advanced stages, cancer cells can break away from the primary tumor and spread to distant sites in the body through the bloodstream or lymphatic system, leading to metastasis. This spread can affect lymph nodes, bones, lungs, and other organs. Urethral adenocarcinoma is a relatively rare malignancy, accounting for less than 1% of all urological cancers. It affects both men and women, although there appears to be a slightly higher incidence in females. The average age of diagnosis is typically in the 60s and 70s. Due to its rarity, accurate epidemiological data is limited, and prevalence varies across different populations and geographic locations. Understanding the epidemiology helps researchers better identify potential risk factors and develop targeted screening strategies. The signs and symptoms of urethral adenocarcinoma can be subtle and often mimic other, more common urological conditions, leading to delayed diagnosis. Common symptoms include hematuria, or blood in the urine, dysuria, or painful urination, urinary frequency or urgency, a noticeable lump or mass in the perineum, urethral discharge, and changes in urinary stream. In advanced stages, patients may experience pelvic pain, lower extremity swelling, or symptoms related to distant metastasis, depending on the affected organs. Because these symptoms can be indicative of other conditions, it's crucial to consult a doctor for a thorough evaluation. Diagnosing urethral adenocarcinoma typically involves a combination of clinical evaluation, imaging studies, and tissue biopsy. The process often begins with a physical examination and a review of the patient's medical history. Imaging techniques such as cystoscopy, erythroscopy, CT scans, MRI scans, and PET scans are used to visualize the urethra and surrounding structures, assess the extent of the tumor, and detect any signs of metastasis. However, the definitive diagnosis is made through a biopsy, in which a small tissue sample is removed from the suspicious area and examined under a microscope by a pathologist. The pathologist can then determine if the tissue is cancerous and, if so, identify the specific type and grade of cancer. While there isn't a universally accepted classification system specifically for urethral adenocarcinoma, it is often classified based on its location within the urethra, anterior or posterior, its histological subtype such as clear cell adenocarcinoma or papillary adenocarcinoma, and its stage, which describes the extent of the tumor and whether it has spread to nearby lymph nodes or distant sites. The TM staging systems as tumor node metastasis is commonly used to assess the stage of the cancer. Understanding the classification and stage is crucial for guiding treatment decisions and predicting prognosis. Treatment for urethral adenocarcinoma is complex and often requires a multidisciplinary approach involving urologists, oncologists, and radiation oncologists. Treatment options depend on several factors, including the stage and location of the cancer, the patient's overall health, and their preferences. Surgery is often the primary treatment modality for localized tumors, involving partial or radical urethrectomy, which is the removal of part or all of the urethra. Radiation therapy, either external beam or brachytherapy, may be used as an adjunct to surgery or as a primary treatment for patients who are not suitable candidates for surgery. Chemotherapy may be used to treat advanced or metastatic disease. In some cases, targeted therapies or immunotherapies may be considered. Clinical trials offer patients access to novel treatment strategies and contribute to advancing our understanding and management of this rare cancer. Due to the lack of a clear understanding of the specific causes of urethral adenocarcinoma, there are no definitive preventive measures. However, certain lifestyle modifications and proactive healthcare practices may help reduce the risk. Avoiding smoking, maintaining a healthy weight, and promptly treating any urinary tract infections or urethral inflammation may be beneficial. Regular check-ups with a healthcare provider, especially for individuals with a history of urethral problems, can help detect any abnormalities early, potentially leading to earlier diagnosis and treatment. The prognosis for urethral adenocarcinoma varies widely depending on several factors, including the stage at diagnosis, the histological subtype, the completeness of surgical resection, and the patient's overall health. Early-stage tumors that are completely removed surgically have a more favorable prognosis compared to advanced-stage tumors that have spread to lymph nodes or distant sites. Recent research efforts are focused on improving our understanding of the molecular mechanisms driving urethral adenocarcinoma, identifying novel therapeutic targets, and developing more effective treatment strategies. These efforts hold promise for improving outcomes for patients with this challenging disease. Researchers are exploring personalized medicine approaches, using genomic profiling to tailor treatment to the individual characteristics of each patient's cancer.